All right, guys, welcome back to Underground Science. In this video, we'll be talking about hemophilia C. Okay, so it's autosomal recessive, so that's important to know, right? So you need two mutated copies to get it, and it's most commonly seen in Ashkenazi Jews. Okay, so that's important to know for the exams. Now, right, if we again review the coagulation cascade quickly, right, factor 3 activates factor 7, which then converges to the common pathway. Then that's the extrinsic pathway, right? Then you have factor 12, who activates factor 11, who activates factor 9, who combines with its cofactor factor 8, who then converts to factor 10. Factor 10 activates factor 5. Factor 5 converts prothrombin to thrombin, right? Which is factor 2. And factor 2 converts fibrinogen into fibrin, okay? Factor 2 also stimulates platelet aggregation, right? Platelet aggregation, and factor 2 stimulates and activates factor 13, who then stimulates cross-linking of fibrin, so you can form a stable platelet plug. Okay, so that's a basic quick rundown of the coagulation cascade. Now, in hemophilia C, you're deficient in factor 11. Okay, so you're deficient in factor 11 in hemophilia C. Now, compared to hemophilia A and B, this is less severe. Okay, it's more milder compared to A and B. So what that means is, will you see? So usually, right, you won't see hemarthrosis or muscle hematomas, right? So usually you won't have any hemarthrosis or bleeding into your joints, right? Usually you won't have, and the reason why I say usually is because sometimes you can see it, right? But usually you won't because it's way milder when comparing it to hemophilia A and B, where you do see hemarthrosis, muscle hematomas, and so on. Okay, so usually you wouldn't see muscle hematomas. Usually you wouldn't see CNS bleeds, right? But you can see, right? So I'll put a positive sign here, but you can see bleeding after minor trauma or surgery, right? Like a dental procedure, for example. Okay, so let's go and see what we have next. All right, so let's talk about the labs. So similarly to, if you compare this to A and B, right, it's going to be similar labs. So again, what's the problem, right? The problem's in factor 11. So factor 11 is part of the intrinsic pathway. Who measures the intrinsic pathway? PTT. So your PTT will be elevated. Is there anything wrong in factors 3 and 7, which is your extrinsic pathway? No, right? So your PT, normal, right? Is there anything wrong with your platelets? Right? No, right? So your platelet count, normal. Again, there's nothing wrong with your platelets, right? So your bleeding time, normal. Okay. Now, if you did a mixing study, right? If we compare this to hemophilia B, it's the same thing, right? If you compare it with hemophilia B or A, if you mixed a normal patient's plasma into the plasma of a patient who has hemophilia C, the PTT would correct because a normal patient's plasma would have normal amounts of factor 11. Of course, the plasma of a patient that has hemophilia C doesn't have factor 11. So if you mix normal plasma with the plasma of a patient that has hemophilia C, right, the plasma belonging to the patient who has hemophilia C will then have hemophilia C, right, will then have proper amounts of factor 11, which means the PTT will correct after mixing. All right. Same thing you would see in hemophilia B, right? Which is a deficiency in factor 9. If you mixed a normal patient's plasma, right, who has normal amounts of factor 9 into the plasma of a patient with hemophilia B who has no factor 9, then of course you would expect the PTT to correct because then the plasma belonging to the patient who has hemophilia B would have proper amounts of factor 9 in order for the PTT to go back down and correct. Okay. So so that's what I mean by doing a mixing study. All right. And that's basically it, right? So for this, for treatment, right, if you can give fresh flowing plasma, which contains factor 11, right, along with other coagulation factors. But if for some reason if it's severe, then of course we can give factor 11, recombinant factor 11. Okay. So that's basically it for this video. It's hemophilia C. Those are the main things I wanted to talk about. Hope this was a little bit helpful. Hope it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.